Hey everybody, it's Dr. Mary Gardner with Lap of Love Veterinary Hospice. And today I'm going to talk about everything you need to know about a disease called Cushing's. Now, I did a Facebook Live on this about 2 years ago, and it is actually one of the most watched Facebooks that I've ever done or video that I've ever done. And so I know there are a lot of you that have a dog with this disease, or you might be, suspicious of this disease and you want to know all about it. So I decided to redo this video, but this time bring in a veterinary specialist. And so what is the specialist? That means that they go into more detail, more schooling, like at least 4 years, and they've got a lot more letters after my name, after their name, and they are really skilled in internal medicine. So that's who I've invited today, is an internal medicine specialist. And without further ado, I'm going to bring her on. And this is Dr. Tatiana Mirkovic. Hello.
Hi, Mary. How are you?
I'm good. How are you?
I'm doing well. Thank you.
Good. Now, listen, I wanted to pop up your details here so everybody can see. Veterinary board certified internist. And you are out of Canada, correct?
Yes, I live in the greater Vancouver region on the west coast of Canada, just a few hours north of Seattle.
So beautiful over there. Listen, I am so thankful for you to come on with me today because, like I said, this video I did a couple years ago is like a lot of people watch it. I probably get a comment on it every week at least, just either, thank you or more questions. So I know there's a lot of people out there that are, dealing with this disease. Now, when I was in veterinary school, I remember learning about this in endocrine class, and it was a really hard disease for me to wrap my mind around. I think I needed to read this chapter a lot, over and over. I've now
I agree.
Right? It's a hard one. So don't feel bad, people out there, if you can't understand this and your doctor starts talking about things. It is a really hard one to understand, and there's pathways so I, Dr. Tatiana, have not only had one dog, not 2 dogs, but 3 dogs that have had Cushing's, and both kinds. So I think I've learned more as a pet owner than as a doctor.
Yeah, so you're pretty close to being an expert there,
I really deserve some letters.
Yeah.
Like kidding. So let's start with the basics. What is Cushing? I don't know. What's the best way to start with the basics? What the adrenal gland is?
Yeah, it's a big conversation, and it is hard to know where to start when you're talking to pet owners, especially if somebody hasn't had some advanced biology classes, right, in high school or college. But basically, most people have heard that we all have a stress hormone called cortisol in our body.
Yes.
And we produce more of it when we're stressed out, to help our body and our organs and our cardiovascular system deal with stress. So it's also one of our fight or flight hormones. So if somebody scares you, your cortisol levels go up, or if you're sick, your cortisol levels go up to help your body deal with stress. And cortisol is produced by 2 little bean-shaped glands that we all have, just like our dogs and cats have, but they are deep within our abdomen, near our kidneys and near some of the important blood vessels. Yes, Mary's going to point to you guys roughly where they are.
I think they're even smaller than this.
Oh, they're much smaller than that. Generally, they're smaller than 7 millimeters in width. They're a little bit longer. So if you think of what a kidney bean is like, in your bowl of chili, that's what your adrenal glands are like. And we all have 2 of them. And if they're normal and healthy, that's how big they are. But they produce cortisol as well as a few other important hormones. And they produce some things called adrenal sex steroid hormones that can also sometimes maybe mimic the effects of increased cortisol. Yeah. But the adrenal glands are also under the influence and regulation of our pituitary gland, which sits pretty much in the center of your brain,
right?
Human brain and dog and cat brain, and right above the roof of your mouth.
Right.
And the pituitary gland also produces a lot of important hormones, and it's connected to something called the hypothalamus above it. And then the pituitary gland secretes hormones that help us regulate how much urine we produce and how much we pee. It helps regulate things in the kidneys. It also regulates our thyroid gland, which is in our neck. And it also sends an important hormone called ACTH for short, called adrenocorticotropic stimulating hormone, which sends signals to our two little adrenal glands in the belly to produce more cortisol when needed.
Okay.
So everything's really closely connected. And then the adrenals, if they produce too much cortisol, they send a inhibitory signal back to the brain to tell the brain maybe to produce less ACTH, to send less of a signal to the pituitary. So it's all terribly complicated and interrelated.
Yes. Okay. So basically, the gland in your head tells your adrenals produce steroids.
Exactly. When necessary. Yeah.
When necessary. Right. When necessary. Yeah. And then sometimes the adrenals will be like, don't need to produce anymore. We're good. So it's a little messaging system.
Exactly.
Perfect.
And it's constantly talking to each other. And the other important thing to know is when we're healthy, we all produce a low level of cortisol, even when we're not stressed out. And we need that for all of our other organs to function normally and be healthy.
Right, because we could do another video on Addison's, which is the opposite of this, when your adrenals aren't producing enough steroids.
Exactly, and then you can get sick from that due to a cortisol deficit, and that's actually a life-threatening condition.
Yes, I saw way less of that when I was in general practice, but a couple of cases. So I was like, oh, this is the opposite. Okay, so what are some of the signs if you've got too much steroids floating around your system?
Yeah, dogs with Cushing's disease can have a whole list of possible signs and symptoms that owners might start to notice at home. And usually these come on rather slowly and gradually, but occasionally they can seemingly come on really quickly. Yeah. And probably the most common signs and symptoms are that people will notice that their dog is drinking a lot more than they used to. And often they will notice a corresponding increased amount of urine being produced, or they pee more often. They may need to get up at night to go out to pee. They may have accidents in the house, whereas they didn't used to have these changes. And owners start to notice that they're having to fill the water bowl more often, or the dog is emptying the water bowl and looking for more water. So that's probably the most common. Mm-hmm. The next most common thing might be an obvious increase in their appetite. Maybe they've always been just so-so about food, or always an enthusiastic eater, but now they're like looking for more food. They're scrounging for food. They're asking for food earlier, maybe even trying to get into the garbage to look for more food when they didn't used to do that, and starting to steal, food out of your toddler's hands or off the coffee table. Whereas when they didn't have Cushing's disease, they didn't have that heightened appetite, and they weren't misbehaving like that. Okay. So those are probably the most common things, but there's a lot more things we can talk about if you want me to go over them, Mary.
I think the two bigger ones, or ones that I often hear of a lot, is the pot belly, and then the skin issues and fur, and
yeah,
I think those
exactly. So some owners will start to notice, or your veterinarian might notice this and mention it to you just when you go in for your yearly vaccines and exam with your pet. Sometimes people will notice their pets start to look like they have a pot belly, like a saggy belly, and sometimes the back kind of dips down as well, and the belly is big and saggy. And that's because when you have excessive cortisol in your body due to the Cushing's disease, you get a redistribution of fat from kind of a layer all over the body into the abdomen and also into the liver. And the liver gets a bit big and swollen. Doesn't necessarily get sick or malfunction, but the liver is bigger. And then we can sometimes feel that on examination and sometimes see it on x-rays and ultrasound. And then cortisol actually affects the growth of our hair and the health of our skin. And so animals who have Cushing's, which is untreated, the hair growth cycle is affected, and it may actually sort of halt. So hair that has fallen out won't regrow, and hair that has been shaved, say to put in an IV catheter, or a shaved belly for an ultrasound, or a hot spot that was shaved and cleaned up, the hair may not grow back. And those are things owners and people will notice. And sometimes people just come in and there's just a diffuse but mild loss of fur, to the point where you can start to see the skin where you didn't normally see the skin over the trunk of the body. The pet's body, their chest and abdomen is the most common sight.
Yeah. Well, for me, for my first dog, Neo, he was a Doberman, and he was 9 years old, and I came home and he had an accident in the house, and he's never had, like, even when he was a puppy, never did anything wrong. So for me, I thought, oh, now I live in a multi-pet house, so I didn't notice the water bowl, like, you know, everybody's drinking everywhere. And so I knew with that one accident, something's up. So I, of course, was thinking about diabetes, kidney disease, and Cushing's was on my list. My second dog, which was a Samoyed, she's over there, she was diabetic. So it got a little tricky with her because I knew she was drinking a lot with that. But her diabetes started to get a little wonky and not very well regulated. And so just in my testing of her for that, I noticed, you know, we diagnosed with Cushing's. And then my last one, Sam, it was maybe a year and a half ago. No, two summers ago, I shaved her. She was an Anatolian Shepherd, so very furry. And moving back to South Florida, it was very hot. So I shaved her and her hair was not growing back. And she started to get skin infections and nasty. And I was just, it's Florida, it's yeasty, it's whatever. Like, because she had no other signs except for this fur problem. She was not a big, heavy eater. No, you know, she's such a, you know, we go outside all the time, so I didn't notice if she was peeing more. So I don't want people to feel bad if they don't notice some of these things. Like it was, for Sam, nothing I would have noticed except for her fur not growing back well. And I took an x-ray actually for her hips because I was worried about her mobility issue. And I thought, that liver looks a little big. And then and that's when I started to do more testing. So it was only because of that. So I don't want people to feel bad that if it's kind of, they don't notice it and they only hear about it on their yearly exam.
Yeah, and you know, I think people should give themselves a break because some of these changes, when they occur gradually, they're subtle. And when you're with your pet every day, you might not even notice them. Whereas your grandmother who hasn't seen your pet in 6 months might come over and notice, oh, why is Boo Boo's hair so thin? It didn't used to be like that. And you're like, oh, you're right.
Right.
Yeah.
So you're right. Everybody takes some credit. So now what's the next step? So usually, you know, you'll bring your pet into your veterinarian and for me, like with Sam, you know, I noticed on the x-ray and we did just initial blood work, which showed elevation in the liver enzymes. So that's usually when most people might get, you know, without signs, a veterinarian may say, well, there's some elevation in liver enzymes. So what's that about? Like, why does that happen?
Well, the reason that happens is, so when you have Cushing's, your cortisol levels are elevated, and that will induce, we all produce this enzyme called ALP, and it can come from the liver, but it can also come from bone and other places, and there is a form of that enzyme. There's multiple forms, and one is called a steroid-induced isoenzyme of ALP. And so when your cortisol is high, which is a steroid, it makes that portion of that enzyme or that isoenzyme elevated. And it's one of the most common things we'll see on a blood panel in a dog who has Cushing's disease. So it's
not like liver failure.
No, and that's the important thing. It would be very unusual for the liver enzymes just tell us that something is amiss in the liver. They don't tell us if the liver is in fact sick or malfunctioning. So they're just a flag to tell the doctor something's not perfectly normal here. You need to go investigate with more blood tests, usually ultrasound and other testing as to why these enzymes are elevated. And in some dogs, it could be due to Cushing's disease, but it could also be due to liver disease in the intestinal tract, and many, many other disorders. Okay. But an elevated ALP is the classic flag that clues some vets in, oh, maybe this dog's fur loss and excessive drinking the owner noticed is due to Cushing's, because I'm also seeing elevations in this particular liver enzyme. And Fufu didn't have that last year when we checked his blood panel 12 months ago or something like that.
Yeah.
Yeah.
So now,
and some of the other enzymes can also go up because of the fatty changes that happen in the liver cells themselves. So you'll see other enzymes go up to a lesser degree than the ALP.
But ALP is the big flag. So
exactly.
That's why doctors want to first do that. And then let's talk about the thing that I needed to be like schooled on 10 times. And it's the stim tests.
Okay.
So what, now I've got a dog and Ellie's got high ALP and she's, you know, eating like a beast and peeing. Now what?
Yeah, so the important thing for owners and general family veterinarians to remember is you need to have a clinical suspicion that the pet has Cushing. So you need signs or symptoms and potentially some abnormalities on your blood panel and your analysis that might further clue you in that I need to screen this dog with some special tests to see if they indeed do have Cushing's. We shouldn't be testing dogs for Cushing's if they don't have signs and symptoms of Cushing's. This is a clinical diagnosis, and the special lab tests and imaging tests we use as the next step are to try to confirm if those signs and symptoms are due to Cushing's or something else, if that makes sense. And so unfortunately, there's not one perfect test that can give us a black or white answer if a dog has Cushing's or not. And that's super frustrating for veterinarians, veterinary specialists, and owners. Because we kind of have to go through it in a stepwise fashion. And I always prep people up front that this is a stepwise process, and I'm probably not going to give you an answer just after doing one test. So I really try to set that expectation so that owners understand and don't end up being frustrated when they don't have an answer after the first test. Sometimes we're lucky and we do the first test and we have a pretty good idea that they do have Cushing's. But if the test is negative, it doesn't mean they don't have Cushing's, and we may have to do a second and a third test and an ultrasound. So there's two most common screening tests that are blood tests that evaluate how the body's pituitary adrenal axis interacts and evaluate the cortisol levels, and they're called screening tests for Cushing. So we use them to screen patients for Cushing's. And the best one is called the low-dose dexamethasone suppression test. It's the most sensitive test that's going to identify the highest amount of dogs who actually have Cushing's. And we're going to get the lowest amount of false positives on that test. So we're not going to get a false positive that says the dog has Cushing's when they really don't. Unfortunately, that test takes all day. It's an 8-hour test where the dog generally spends the day at the clinic, and they have a sample taken at time 0, then an injection of a little bit of a steroid, and then their blood is sampled again at 4 and 8 hours before they go home. But that's our best screening test, and most veterinarians and specialists will start with that test.
So now what is it tested for? So we inject the steroid, and what are we looking to see in, 8 hours later for?
Right. So in a healthy dog that doesn't have Cushing's disease, what we look at is what is the time 0 cortisol. And it can be normal or it can be elevated because just the stress of coming to the vet clinic can elevate it. But in a normal dog, what will happen is if you give it an injection of what's called a low dose of dexamethasone, which is given intravenously through a little vein, in a normal dog, that low dose of dexamethasone in the bloodstream will provide some negative feedback to the brain, to the pituitary, and it will suppress the secretion of this hormone called ACTH. So there will be less of that secreted and less signal sent to the adrenals to produce cortisol. And as a result, the 4 and 8 hour cortisols, but especially the 8 hours, are generally suppressed compared to the time 0 one. And so if your time 0 is up here and then your 8-hour one, which is the most important one, is suppressed at a level that's no to look for, that says this does not support Cushing's disease. Everything looks like it's working properly, like it should in a healthy dog. But if your time 0 cortisol is here and your 8-hour blood sample cortisol is not suppressed, or is only suppressed a little bit, or is even higher, then that says this supports that the dog may have Cushing's, and you may need to do some further investigating to solidify your diagnosis and also try to determine what type of Cushing's they have.
Perfect. So listen, I want everybody to realize that if you have to rewind this and play that little part again and again, don't feel bad, because that's what I needed in vet school, is that it's like the negative reverse, discussion between the adrenal and the pituitary. It just drove me bonkers trying to understand this.
What I want you guys all to know is this is one reason I became a specialist, because my mind was jumbled as a veterinary student. I wanted to understand this, and I had to go back to the notes and the textbook so many times. And I thought, I just need to be really good at something. So that's why I'm going to specialize, And it wasn't until I honestly started my specialty training and started seeing a lot of these patients and treating them and studying more and more that I really started to understand this. So give yourself a break as a pet owner, and give your family veterinarian a break, and understand if they feel that they might recommend you see a specialist to try to figure this out, or even to help you treat it.
Yes.
Because not everybody's comfortable with it, even if they're a good veterinarian. And so you need to trust your vet's recommendation.
And I want to talk about that at the end of this, about who to see. And because with that second dog I talked about, my Samoyed, I needed help because she had diabetes and Cushing's, and together that was above my pay grade. Couldn't understand.
It's a super complicated situation, and it requires somebody who knows what they're doing, really careful monitoring. And if your vet says we need help, we need the help of a specialist, trust them. And if that's something you're able to do, go for it if your vet recommends it.
Totally. So now what's that other test that you were going to mention?
Yeah, there's a second test that's commonly run as a screening test for Cushing's called the ACTH stimulation test. It's also a blood test. It's easier to do because it only takes 1 hour, but it does take 2 blood samples. It's a little bit more expensive than the ACTH stimulation test, but it's certainly more convenient to do. It's not quite as good as the one I mentioned before, the low-dose dexamethasone suppression test, because you can get a lot more false positives, meaning it will suggest the pet has Cushing's more often when they truly don't. And the reason for that is this test is more affected by just being stressed out. And if your pet has other diseases, like say your pet has undiagnosed Cushing's, but also has undiagnosed diabetes, like Mary's dog maybe, if you only do an ACTH stimulation test, that dog's body is stressed out because of multiple diseases. And also the dog is excited and stressed to be at the vet clinic. And so you might get an exuberant response on that test, cortisol levels that are higher than they should be just because of the other disease, maybe not Cushing's. And you could get a false positive or interpreted as this dog has Cushing's when they maybe don't. It's a really good test, but it's not as sensitive as the low-dose dexamethasone suppression test. So I'll often nowadays, now that I have more experience, I use it as my second line test often. And it's an important test that sometimes we like to just know where the dog is sitting on that test, even though we don't need it for a diagnosis, because it gives us a baseline before we start treatment, because that is actually the test we use when we're monitoring treatment. Yes. Maybe I'm getting a bit ahead of myself now, but we might come back to that.
Yeah, but that makes sense because that's what I did when I was okay. So now we've got suspicion. So one of these are high. Next step.
So, yeah, so let's say you're the best test. You've run the low-dose dexamethasone suppression test, and your vet tells you the results support that your dog likely has Cushing's and the signs and symptoms fit. So at that point, most people will want to try to differentiate, is this pituitary-based Cushing's, which is most common, and we may talk more about that, or adrenal-based Cushing's.
Yeah, so maybe we should talk about the 2 different types.
Yeah.
This is a good spot maybe to talk about that, because then somebody even asked about it, because that's the problem. So what are the two main types? Because I know there's iatrogenic, which somebody even talked about, but
yeah, for sure. And we should come back to that maybe if we have time, the iatrogenic. So the two types of Cushing's that occur naturally. One is pituitary-based Cushing's, which is caused by typically a tiny microscopic tumor. That means that you usually can't see it if you image the brain with a CT scan or an MRI. So it's small, but it's in the pituitary gland, and it's making too much of a hormone called ACTH. And most of these tumors are benign. So they're not cancerous, but they are a tumor, and there's some abnormal cells that are there that are making too much of the hormone called ACTH. And because they're making too much of that hormone, they send a signal down to our adrenal glands in our belly, exactly, and they tell those adrenal glands to produce more cortisol.
Yeah.
And when your adrenal glands are chronically getting too much of that signal, those adrenal glands typically, not always, will get bigger, both of them, and look a bit plump. And so that's the first type of, and they'll both get big, not just one of them.
What's important is that because it's not selecting one adrenal or the other, it's just the circulating hormone. And so both, it's almost like working both your biceps, both get big. Like I know our little screen.
Exactly.
So both will get bigger because that's important with our like next step.
Yeah.
Now,
and sometimes they're not equally bigger when you image them with ultrasound or CT, but usually they're both considered bigger than normal.
Okay.
Not always. Some dogs who are in the early stages of Cushing's can still have adrenal glands that look normal on ultrasound. So you can't rule out Cushing's just because the adrenals look normal on ultrasound.
Yeah. Okay.
Okay. If everything else fits. Okay.
Okay.
So that's pituitary-based Cushing's. And then adrenal-based Cushing's is due to either a benign, so non-cancerous tumor, or a cancerous tumor in one, usually one, thankfully, rarely both, which is a really confusing situation that we probably won't talk about here today. But usually a tumor, benign or cancerous, in one of the adrenal glands in the belly there. And so it's overproducing too much cortisol. Just that tumor itself, it has nothing to do with the pituitary gland. Just some of those cells have started to grow abnormally, and what they do is they just overproduce cortisol, the hormone that is associated with Cushing's disease, and that causes all the signs and symptoms of Cushing's. And generally what will happen, one of those adrenal glands will get bigger and swollen, and the other one actually senses that there's a lot of cortisol in the bloodstream, and it'll actually say, oh, there's lots of cortisol, I don't have to do my regular job, I'll just go to sleep. It takes a vacation, and it kind of atrophies and it shrinks. So if we do an ultrasound or a CT scan of the dog's abdomen, the dog with adrenal-based Cushing's disease, what we're looking for in a classic case is that one of those adrenal glands is swollen and bigger than normal, and the other one is typically smaller than normal.
Okay.
Yeah.
So would your next step be abdominal ultrasound after blood?
Often, yes. Yeah. And we used to do an abdominal ultrasound in almost all animals, but nowadays radiologists are finding that they have a hard time imaging giant breed dogs with ultrasound. So sometimes a CT scan of the abdomen is better.
Okay.
And nowadays we can do that just under sedation, which is nice with a fancy quick CT scanner. But usually we're using an ultrasound, and usually it's somebody with a lot of experience doing ultrasounds, either a general vet who has shown a lot of special interest in ultrasound training and is very experienced, because the adrenals are hard to find. So a lot of general vets, I can't find them. I'm not that experienced. So usually we leave the imaging to a veterinarian who's pursued a lot of extra training, or a veterinary internal medicine specialist like myself, who spent a lot of extra time and training learning how to do ultrasounds, or a veterinary radiologist who's the ultimate specialist. And they'll do an ultrasound with the focus looking at the size and shape of the adrenal glands, but also the liver. Does the liver show some changes that we typically see with Cushing's disease? And also, we also want to make sure that this middle-aged to older dog typically doesn't have some other serious disease problems going on that they're not showing signs and symptoms of yet that we probably want to know about before we make a challenging decision on, well, this dog has Cushing's disease, whether it's adrenal or pituitary dependent, and do we want to treat that? You know, because if we find something else unexpected, that's going to play an important part into that decision process.
Totally. So with Neo, I did my ultrasound and it showed one big adrenal. And for my other two dogs, they both had two large adrenals. So if everybody's with us, right? So the one is probably now is the adrenal tumor, and the other is the pituitary tumor, because both are bigger. Do you happen to know what the percentage is? I think it's more pituitary. Adrenal is less likely, but do you know the percentage?
I think it's around 85% of dogs who have Cushing's have generally just an overall, all dogs, pituitary-based Cushing's. Okay. But there is an important difference is in smaller breed dogs, the incidence of Cushing's disease, pituitary-based Cushing's is much more common than adrenal-based Cushing. So if you have a little poodle, a Yorkshire Terrier, or a miniature Schnauzer, just as a generality, you're most likely going to be dealing with pituitary-based Cushing's. Well, if you have a large breed dog, much higher incidence of adrenal tumor, more closer to, not exactly, but closer to like maybe a 50-50 chance. If say you have a Doberman or a Samoyed, that 50-50 chance that it might actually be adrenal-based Cushing's. And that's why it's so important to do that imaging and try to, if you need to, and try to determine if it is adrenal based, because that's going to affect treatment options and decisions.
Yeah. So while we're on that one, even though it's less common, let's just knock that one out, because that's when my first dog Neo, that's what he had. And so my options.
And what breed was Neo? What breed was Neo?
Oh, he was a Samoyed.
Doberman. Okay, yeah.
So my first was a large, was the Doberman. Who did nothing wrong, one pee accident in the house, and I went for testing. So
he read the textbook. He said, "I'm a large breed dog. I have an adrenal tumor." Right?
Yes, pretty much. So my decision then is do nothing, medical treat or surgically treat. So so for me, I ended up going the surgical route. So brought him to another specialist, because again, like we mentioned earlier, these are tiny little glands somewhere in the mystery body, because it's not easy to find. They're not just sitting there. So I went to University of Florida, where he had an adrenalectomy. So he had it removed. And that was what I opted for, because now you said that the adrenal tumor could be benign or malignant, because if it's benign, done. I'm done, right? Removed, done. Now, this is not a cheap surgery. This was a couple of $1,000s. So I want everybody to know this was, thank you, Care Credit. I was able to afford it and, and pay it off. But I did that because I wanted to be done. And that was my hope. Do you know what the percentage are between benign and malignant or not benign? Is it?
Yeah, again, it's close to about 50-50.
Okay, yeah. So
and unfortunately, there's no good easy way to determine if it's benign or cancerous, malignant, until you take that adrenal out and send it to the pathology lab for the pathologist to look at under the microscope.
Yeah, so you had to take it out. So, but I will say, like, I remember when he woke up from surgery and they called me in, and because I'm a veterinarian, they're like, do you want to see the tumor? Do you want to see the adrenal gland? And I'm like, yes. So I was a little creepy and I wanted to see it. And I looked at it and it looked angry. It looked like an alien. And I just kind of knew that's not good. That's not just a benign growth. And, you don't know until you send it out to pathology. But my hopes dashed, I think, at that time, because I was hoping for the 50%. And for Neo, it turned out that it was malignant, and so it was bad. And so, but I did other treatment options. So what if I did not want to do the surgery, and I wanted to medically treat?
Right. Well, the one thing I'll tell all your owners who are maybe listening is surgery is the optimal treatment for an adrenal tumor because, number one, you don't know if it's cancerous or benign before you remove it, and it offers you the option for a cure.
Yeah.
But it's also not a realistic thing for a lot of families and people to pursue, and it might not be for you. And also, if your ultrasound or CT or chest x-rays have maybe shown that the cancer maybe has spread, if you're unlucky, then you may not want to pursue surgery, and medical treatment still an option. If it's spread, or even if it hasn't spread, if you see no sign of spread on your ultrasound or chest x-rays, but you've still said, I can't do this surgery for whatever reason, I don't want to, I'm not comfortable, or I can't afford it, lots of different reasons, then you still do have an option to try to treat it medically. And we can use the two drugs we use to treat pituitary-based Cushing's to treat an adrenal tumor with as well. And they work differently, and there's some advantages and disadvantages of both. One of them is actually, I don't like to use this word when we talk about Cushing's, but it is a chemotherapy drug. It's called mitotane, and it only targets the cells of the adrenal glands. So we're super lucky. It's a super targeted chemotherapy drug. It's given in pill form. It's easy to give. It just requires super careful monitoring and veterinary guidance. And it actually targets the cells of the adrenal glands that are overproducing cortisol. And we try to wipe out enough of them that your cortisol levels go from really high levels to low normal levels, so you can function normally but not have depleted levels and get sick from that. And then there's another drug called Trilistain, which is sold in North America under the brand name called Veteril, that maybe some people have heard of, made by a company called Dechra. And that is not a chemotherapy drug, and it works totally differently. It's given for life, and it inhibits the production of cortisol from precursor hormones in the adrenal gland. It inhibits an enzyme, so it kind of blocks the production of cortisol, and you give it once or twice a day for life, basically, and it still requires monitoring. But again, we're bringing the cortisol levels from an excessive level down to a low normal level is the hope, and by doing so, we're controlling the signs and symptoms and the negative effects of excessive cortisol levels on the body, because we're keeping them at a low level for the rest of the dog's life if we can.
And both of my dogs were on Trilistain. And, you know, unfortunately, it can be expensive for people with the testing, with, you know, because we do want to redo blood work a number of times throughout the year to make sure that we're not, you know, doing more harm than good, make sure we're on the right track. And for Sam, she was a 70-pound dog, and it was about $180 a month. And that's
just the medication, right?
Just the medication. And I had to get it at a compounding pharmacy because of her weight. So, you know, I don't get a discount or anything like that. Some people have said, oh, aren't we lucky we get discounts? Not like, we got to pay for stuff too. And so it was $180 and a month. And that's hard. That's hard for some people. And now, important thing I tell all of my clients when we're trying to decide, after we've diagnosed Cushing's, but trying to decide, should we treat it, and is this the right decision for your family? I tell them what they can expect to spend over the first 12 months on treatment if there's no illness or complications. And it's substantial, and the costs are going to differ from country to country and depending on what drug you're using. But the visits for monitoring and the blood tests for monitoring are not an option. You have to do them. Otherwise, it's basically dangerous for your pet and malpractice on the part of the veterinarian if they're not monitoring. So if it's not right for my client, I talk to them why that decision is okay. You know, it's not a disease you have to treat, and it's a very important and individual decision for each pet and every family. For sure. So yeah, let's talk about not treating and maybe even life expectancy with the treatment. So that's hard to say, you know, is this a disease that's going to be life limiting if let's say treated and everything's going well?
Yeah. There are some studies out there that have shown, that have looked at, you know, do dogs who are treated with mitotane versus Trilistain, how long do they live, and do they do better with one treatment or the other, and are there more complications with one treatment or the other, and risks and stuff. They've basically shown what you could expect is hopefully a 2 to 3 year survival on average. And people generally think that Trilistain is safer than Mitotane, but the actual rates of complications and negative side effects are fairly similar. So generally I would tell people 2 to 3 years, but definitely can easily go beyond that if you're lucky. And I find this is a disease of middle age to older dogs.
That's the other thing.
And so often there are other factors that come into play, like diabetes or heart disease or kidney disease or unrelated liver disease or unrelated cancer, just because like older people, older pets get other diseases and problems. And so it's really hard to do studies and say how long are these dogs going to live, because often they may, other factors come into play.
Correct. So
or finances too.
Correct. So for Sam, I got her started on medication, and within 2 months, fur was growing back. She was looking great. She was eating fine, drinking fine. And then a year later, she had unrelated spinal lymphoma. So, cancer in her spine. And so 2 years after diagnosing I had to say goodbye to her because of something else, not because
of the Cushing.
I don't want people to get, like this is the end of the world. It's okay.
It's not the end of the world. What I like to tell people is the reason we want to try to consider treating your dog's Cushing's, if it's the right decision for you and your pet, is to improve your pet's quality of life. Hopefully the quantity as well, but the most important thing is to improve their quality of life, their well-being, and your quality of life too, because if they're getting you up to pee 5 times a night, that affects your quality of life as well. And if your pet is tired due to muscle weakness and lethargy, which we often see in untreated Cushing's, they may not be able to enjoy life like they normally would and go for walks. They don't have the energy to play like they normally would. And if they're constantly just thinking about how thirsty they are, and want to go to the water bowl, that's kind of taken over their life, and they're just not maybe enjoying a normal quality of life. So we're trying to improve quality of life, and there are some consequences of untreated Cushing's on the rest of the dog's body and other organs, and we're trying to lessen those and minimize those by treating Cushing's.
Right. And another symptom that we forgot to mention is panting.
Absolutely.
Like, how did I forget that one? That's a big one.
So I always ask owners, is your pet drinking or peeing more than normal? Are they eating more than normal or hungrier than normal? Do you notice them panting at home for no apparent reason when they're not excited or stressed or hot? So say when you're watching TV and they're just sitting there in the living room with you, are they panting for no apparent reason? Yes. And it's winter time. They're not hot. The fireplace is not on, So that's a common sign or symptom. And we don't really know what causes it. There's a bunch of different theories about it. It's a non-dangerous side effect. But if they're panting all night and keeping you and themselves up, that affects quality of life. So again, treatment will resolve that. And other symptoms.
Not just us, it is them up all night panting. It's bad for both, right? But
can you imagine, when you're restless and you can't sleep and you're tossing and turning all night, you're thirsty, you have to pee, and you're flip-flopping all night? That's not fun.
That's not fun, right? Yeah. No, I can tell you. So not treating is still is an option, but these are the things that they're going to be going through. So there's been a couple of questions. So I want to just hit a couple of these because that way I make sure I include everybody. So we've got Oregon and North Carolina and Florida and Ohio for friends, all these good friends out there. So I know that somebody asked about atypical Cushing's. So actually, wait, let me not go out of my order here. So I had the low dose Dex test twice, first time, total, temper tantrum, 8-hour numbers were not high, then took them back and forth in between blood draws, and the numbers were lower. So I guess she was able to take her pet home in between blood draws. So
some owners who live nearby will opt to do that. You just have to be back on time for the other blood draws.
Right.
And sometimes we suspect Cushing's disease, and you do that low-dose dexamethasone test like that lady did, but the tests don't support the suspicion for Cushing's, and that's frustrating for the owner and the vet. And that's why I said I prepped them up front that you may have to do multiple tests. And sometimes we have that situation where all the signs and symptoms are just like screaming, I'm the poster child for Cushing's disease, but the tests don't support it. And then you and the vet are left scratching your head saying what to do next. And sometimes that means going to see a specialist for a second opinion. And sometimes that specialist will tell you, I agree, everything looks and smells like Cushing's, but the test doesn't support it. And so frustrating, but what we sometimes recommend is waiting 3 or 4 months if the symptoms are mild and tolerable, and retesting, and sometimes checking in 3 months' time or 4 months. That low-dose dex test that previously didn't support a diagnosis of Cushing's now will support it. Yes. Or you may choose to do more and more other tests to see if you can get a strong evidence the dog does have Cushing's on other tests. Right. And there are some dogs which might have a condition called atypical Cushing's, and that's really complicated and a bit too complicated probably to explain here. And even amongst the veterinary professors and specialists who research this disease, there's still a lot that they don't know, and a bit of disagreement as to does atypical Cushing's exist or not. And what it usually refers to is some much rarer genetic disorders that influence hormone secretion from the adrenals, and or kind of some pathways leading to cortisol production in the adrenals that may be blocked, resulting in some other hormones being overproduced, like a type of progesterone, something called 17-hydroxyprogesterone or androstenedione. We won't get into those, but sometimes these other hormones, which are commonly called adrenal sex steroid hormones, are elevated, and perhaps in some dogs those may mimic the effects of excessive cortisol and cause the signs and symptoms of Cushing's. Or maybe this atypical Cushing's is just an early phase of overall Cushing's, and if you wait a few months or 6 months or a year, that dog's cortisol levels will go up, and the classic usual screening tests like the low-dose dex and ACTH stim test will all of a sudden look positive for Cushing's.
Okay. Now what about iatrogenic Cushing's?
Right. So iatrogenic is a word that basically refers to we have caused it. Humans have caused it. And it basically, if people and dogs can get it, if we take steroids to treat another disease in pill form or an injection form, in which we use steroids to treat a lot of other diseases, if we take them by mouth, or if they're applied to the eyeball or in the ear, in ear medications, or topically to the skin. If your pet has lots of skin issues, a lot of the medications will contain steroids. And depending on how sensitive your pet is, and depending on what you're treating and how high the doses are, if your pet has too much steroids given to them by mouth or topically, that can cause signs and symptoms of Cushing's disease.
Yeah. Now, what's the
so they may have all those signs and symptoms we talked about before.
Now, what's the difference between Cushing's and Cushing's syndrome?
So Cushing's syndrome just refers to the signs and symptoms of Cushing's.
Of Cushing's.
Yeah.
Okay.
And Cushing's disease is more like you have the disease. It's been diagnosed. Yeah.
So Heather asks if you have any recommendations on holistic treatments.
Right. Good question. One that comes up commonly. And I'll admit, I'm definitely open to non-traditional treatments for a lot of diseases. I don't have training in holistic or naturopathic or traditional Chinese medicine myself, so I'm not well versed to comment on that, but it's my experience that non-traditional treatments for Cushing's disease are not likely to be effective for this disease, unfortunately. You know, I wouldn't say that for other things. I am very much a proponent of acupuncture for treatment of various pain syndromes and osteoarthritis and stuff like that. But I've seen many dogs come to me for a third or fourth opinion where they have been on a variety of adrenal supplements for a long period of time to no avail, to no improvement. And owners, by that point, the dog is more debilitated and the owner's more frustrated. But certainly, if that's an avenue you want to explore, I would encourage you and your vet to partner with a veterinarian who has spent a lot of time and training dedicated to exploring natural therapies, and talk to that person with experience. Don't just buy something off the internet and start giving it to your pet.
There's a whole study of that.
And if you don't see improvement within a few months, like say 3 or 4 months, probably not going to work, and maybe you should, for this disease, you should explore more traditional avenues of therapy.
Okay, let's see. So Marcel says, so I'm really confused. My vet told me that because my Doxy's liver was slightly elevated, he wanted to do the blood test for Cushing's, and said he couldn't treat Zachary for anything else until I had the $800 test done. I took him to another vet with the same copy of the blood work, and they said it doesn't point to Cushing's. So I guess the initial blood work. And they don't do the test because he doesn't have enough signs for it. He'll be 14 this month, and I'm not sure what to do. The other symptoms, he is runny stool. Some days he doesn't even want to eat one meal. What do you think? So if she just has if the Zachary only has high liver enzymes and no other clinical signs, then maybe not. It's maybe
this is actually a really good question. If your dog doesn't have the typical signs and symptoms of Cushing's, and the only reason your veterinarian said we should maybe test for Cushing's is because his ALP or multiple liver enzymes are elevated, and he's not having a ravenous appetite, drinking excessively, peeing excessively, panting, skin or fur coat changes, or recurrent skin or ear infections, there's probably another cause for the elevation in liver enzymes in your dachshund. And I would not probably you should, again, remember I said we should only test for Cushing's if your pet has clear signs or symptoms of Cushing's. So you should talk to your vet further about that. And I might agree with maybe the second opinion that you got, if that makes sense. And a really important point is, the vast majority of dogs who have Cushing's have a good, healthy appetite. And most of them don't have diarrhea unless they have a second disease problem that's causing the diarrhea. Most dogs with Cushing's, if their guts are healthy and they don't have parasites or any other problems or aren't on medicines that cause diarrhea, they're going to have normal form stools, and they're going to have a nice, normal, healthy appetite, even if the appetite is not increased. So if your dog has a poor appetite, something else might be going on, and you guys should explore that first.
Yes. So Lisa's got a 9.5-year-old dog tested positive for the low dose test, but his symptoms are mild so far, a little panting for no apparent reason, and is more lethargic than normal. She's opted not to treat with Veterol until he gets additional symptoms. Thoughts?
Right. Again, it's a personal decision. Monitoring goes into it, which is your time, frequent vet visits, usually in the first few months of treatment, and considerable financial investments. You're going to spend between a few $100s to up to $1,000 just on treatment and monitoring the first month of treatment. So waiting a while is reasonable if you're comfortable with that. The downside of waiting, if you already have a pretty solid confirmed diagnosis, is that the longer your pet's body is exposed to excessive levels of cortisol, there can be negative impacts on other organ systems like the kidneys. It doesn't cause kidney failure in of itself, but it can impact tissues within the kidney and lead to protein loss through the kidney filter into the urine. And over time, I'm talking months to years, that can contribute to the progression to kidney failure. And some dogs with Cushing's disease will develop elevated blood pressure from their Cushing's disease and the excessive cortisol. And that in of itself can then impact the kidneys negatively. Right. And then just the deterioration in your pet's strength and quality of life, and maybe propensity to getting skin and ear infections and bladder infections, because having untreated Cushing's is actually an immunosuppressive condition. So it's a personal decision. Yep. Your decision's not wrong. It's just if you're comfortable with that decision.
I think that's really important for everybody in both directions. I have been I've been slammed because I did the adrenalectomy. They're like, it was a 9-year-old Doberman. Why would you put him through that? And, and then you're going to have comments on the other direction of not doing something. So like whatever is best for your family, it's, I support that decision. A couple of people asked about diets for this to help support Cushing's.
Yeah, they're not, as far as I'm aware of, there are no particular dietary recommendations specific to your dog having Cushing's, whether it's treated or not treated. Mm-hmm. Dietary recommendations are usually, in this scenario, are going to be specific to whether or not your dog maybe has another concurrent disease, like kidney disease, a gastrointestinal disease, like inflammatory bowel disease, or pancreatitis or something. But there's no specific standalone recommendations for diet.
Okay, good. I didn't think so either. So I'm confirming.
If there is, I'm not aware of it.
Right, exactly. Okay, so then, wait, I had another good one. Sorry, I know this is running a little long, but I knew this one was going to have a lot of questions and feedback. So when you start treatment, so if you start Veterol, about how many weeks until you may see some improvement? That was a good question.
Right. So we're going to recommend that you have to see your veterinarian roughly 14 days and 28 days. So 2 weeks and 4 weeks after starting treatment for a checkup to see how they're feeling and doing, and for the monitoring test, ACTH stimulation test. And dose modifications usually aren't made until the 4-week mark, unless your pet's not feeling well and doing well on the starting dose. But if you're lucky enough and the starting dose that your veterinarian has chosen is effective, at least partially effective, you may start to see reduction or improvement in signs and symptoms, like excessive water intake may go from here to here within days or that first 2 weeks. It may take longer, and each patient's an individual, so the starting dose may not be enough for some dogs. So your vet may take longer. It may take working with your vet for 2 or 3 months before you see really good improvements. So just have patience with your pet and patience with your veterinarian, because if you don't see improvement right away, doesn't mean they're doing anything wrong. It just means that for your pet, this might take a bit longer, more visits, unfortunately, and some medication adjustments to get it where it needs to be.
Yeah, and we like to start low with the medication. We don't
because that's safer.
So we want to start low and then check it and increase. And I did that with Sue. Like she had two different times we increased it just a pinch.
Yeah, and you want to be careful, because over-treating, which would mean that the medicines push the cortisol levels too low, that can be dangerous for your pet. Mm-hmm. And that's why your veterinarian is going to be careful and go slowly and carefully. And you need to trust your veterinarian on that. And as a specialist, and I can speak for myself, and I think most veterinary specialists, we actually usually prescribe far lower doses of Veterol than what it says on the box and the package insert. So don't be shocked if your veterinarian prescribes a lower dose, because a large number of patients will do well and be controlled and treated safely on a much lower dose than what it says on the box. Okay.
Yeah.
So trust your vet, and if they prescribe the dose on the box, and you've heard me say this, don't get mad at them, but have a discussion with them and say, I heard this. What do you know about that? And can you tell me more?
Yeah. Now, is anxiety a sign?
I suppose restlessness can be, and that's maybe a bit hard to differentiate from anxiety. But yeah, mild anxiety and restlessness can be signs and symptoms of excessive steroid hormones in the body. Right. But if your pet has Cushing's and your vet thinks it's well controlled, all the other signs and symptoms are controlled, and the monitoring blood tests suggest that the Cushing's is well controlled, and your pet is still exhibiting signs and symptoms of anxiety, and that either developed since, like it's a new symptom, or it was existing and everything else improved with the treatment, but that didn't, then there may be another cause for your pet's over anxiety.
Yes. This is a big topic, like I said. So we're already at the hour, and I told Tatiana, I'm like, oh, like 30 minutes. So I know a lot of people have other questions, but you are in Canada, so specialists. We were talking earlier about, if your veterinarian needs you to go see a specialist, don't think badly about them. That's them being humble enough to say, this is tough. Let's go.
You know what? Yeah. Not to interrupt, Mary, but the one thing I would tell all the pet owners out there is I think it's a hallmark of a really good family veterinarian to be willing to refer you to a specialist and to tell you when they think you need to go see a specialist. Yeah. Doesn't mean you'll be able to do that, but it's a hallmark of a good veterinarian when they say, I need help. This is above my knowledge base or my comfort level, and to admit that to you and say, I want to send you to a specialist if you're willing. Yeah. If you can't, that's different. Then hopefully they'll help you to the best of their ability.
Right. We'll still try our best. And there are these complicated ones. I know there was somebody asked questions about diabetes and Cushing's and even just, it's not easy. So if there's not a specialist nearby them, I know, Dr. Tatjana, that the primary care, the family veterinarian can actually work with you with like teleconsulting to help then the pet, correct?
Right. Yeah. Most pet owners have heard of telemedicine, where you can do a video chat with your family doctor, right? And tell them what's going on and get a prescription or a diagnosis. And that's now available in veterinary medicine. Where I'm offering vet to veterinarian video or telephone consults. So I don't meet with the pet owner in this particular scenario, but your family veterinarian can consult with myself or a colleague of mine who's a specialist and say, here's what I'm dealing with my patient, here's what the owner's noticing at home, here's what I found on physical exam, and here is all the testing that I've done. But now we're not sure what to do. Or can you tell me more about the treatment options so that I'm better equipped to discuss them with my client? Or here's the treatment and here's how the pet's feeling on the treatment. Here's the monitoring test results, but I'm not sure what to do now. Can you help? And that's how I can consult with the family veterinarian and tell them, review all that, have a discussion with them and tell them what I would do next in their shoes.
That's awesome. Because also there's a waiting line sometimes to see the specialist. It's 4 weeks to see the oncologist down here and a number of weeks to see an internal medicine veterinarian. So if you can't get in to see one, or they're not around you or whatever, or just, still want to stay with your primary care veterinarian.
Right. Or like you live in rural Wyoming. I don't know what your access to a veterinary specialist is, right? It's not going to be the same as New York or Miami.
No, exactly. So one option is with I put the link in the chat, fiduvet.com, and there's other telemedicine options out there as well. So it's okay also if you ask your veterinarian if they don't mind getting a consult with a specialist, just to make sure that there's no stone unturned. All right, I think we covered a lot. I am so sorry to take up a whole hour of your time, but I knew
this was fun. Yeah.
I love
apology needed.
Listen, Dr. Tatjana, it was so nice. Look, I like to put your name up there again because it's awesome, and you are amazing. I wish you weren't in Canada and closer to me, or else so I could see you more. And we've got some information on our website about Cushing's. Please, for those of you who have an old gray muzzle, a weak and wobbly dog, or a skinny old cat, give them some love from me.
There's probably some good resources for owners. I bet if you go to the US website for Dechra, the company that makes Veteril, I bet they have some really good resources there about Cushing's for both veterinarians and for pet owners.
That's a great idea. That is a great idea. Awesome. Well, thank you, Dr. Tatjana.
Thank you for having me. Good luck, everyone.
Bye.
Bye.